Thanks for the invitation. It's a pleasure for me today to introduce to you a remarkable concept of personalized medicine, which has the potential to revolutionize healthcare. Personalized medicine usually goes beyond traditional one-size medicine fit all and instead adopt a treatment to suit each patient's characteristics, which include lifestyle, genetic makeup, and environmental factors. Now, by addressing those factors, personalized medicine aims to optimize a personalized treatment and improve patients' satisfaction and overall better health outcome. Now, it is really important to clarify that personalized medicine does not solely depend on gene therapy or genetic testing. Although this is really playing a very important role, but usually it takes holistic approach and consider environmental factors, individual preferences, and lifestyle. So by incorporating these variables, healthcare providers can design a personalized treatments which take into account those complex combination of the multi-factors which could have an impact on individuals' health. Now, there are so many scientists whom they are really involved in personalized medicine, but not every scientist is really aware that human personality is playing an important value for understanding personalized medicine, and therefore incorporating human personality into personalized medicine offer a great opportunity to improve healthcare. Now, in this presentation, I'll try to show how matching treatment to personal characteristics could really make treatment work better, and hopefully patients will be more satisfied and overall health outcome will be improved. For me, I always consider that integrating medicine with lifestyle or with individuals' lifestyle is the foundation of personalized medicine. So recognizing that everyone has different habits, preferences, and set of values essential in personalized medicine. And now, to make personalized medicine more effective, it is important to develop a treatment plans that are specific to individuals' lifestyles. Now, this include consideration of eating habits, cultural practices, and religious preferences. So by matching medical care to individual lifestyle, so personalized medicine has the potential really to make existing drug more effective and patients more satisfied. In the last couple of years, I introduced a new medicine, a new concept in medicine called Halalopathy. Now, this is really part of the personalized medicine, and this innovative approach usually aims to create a meaningful connection between medicine and lifestyle. So by incorporating the principles of the various lifestyle principles, Halalopathy matches medical intervention to individual beliefs, values, and nutritional needs, while respecting cultural and religious practices. So how Islam dealt with the concept of prevention and cure. Indeed, it is very important that Islam always take the holistic approach and consider both perspective and both dimension, the physical and the non-physical dimension. Now, in case of prevention, so Islam is very clear that says that your body has right over you, means we are obliged, we must keep our body in the best form and shape. So we have to protect our body from disease and maintain a good health. And this is done by both perspective, physical and the non-physical. Non-physical perspective, Islam has already provided a sort of comprehensive guidelines in which Islam told us what to do and what not to do. And the main goal is to create a sort of harmonious environment within our body. So by matching our concept with our behavior, we developed a compatible system, and compatible system has always the tendency to activate and unlock our internal potential, and this is essential for our immune system. If you want your immune system to be active all the time, so we need to keep the immune system in the fight mood, and fight mood required potential energy. If it is available, it will always have the potential to fight any possible or potential disease. That's why Islam emphasized so strongly from the non-physical perspective, always to think always constructive. That's why it's important to maintain anabolic thinking, positive, to be selective in what we want to say, so focusing on expressions. So that's why the word tayyib, tayyib, has really power. And it is also important to avoid fear and grief. Those two elements are essential in shifting our immune system from the fight mood to the fright or to the flight mood, and both moods are very dangerous for maintaining a good health. Now, with regard to the physical aspect, I think Quran and Hadith is rich with many natural products which known to be very healthy, and science has proved its beneficial role in our health. And Islam also recommended us, before we take our meal, it is essential to eat fruits particularly, and this is essential for prevention, again for prevention and protect ourselves from any potential disease. Now, with regard to cure, Islam also talk in this consideration. Islam also considered the holistic approach, similarly, the physical aspect and the non-physical aspects. So in this regard, medicine is representing as the physical aspect, whereas information is representing as the non-physical aspects. Now, information has three sources. It has to be supportive, in form of supportive information, positive expression, and holy book recitation. Now, Islam take into consideration that not all people are Muslim, and therefore we have to diversitize our source of information. And of course, if you are Muslim, the easiest source of information which will act as a full supportive information is by reciting from the Holy Book, Quran. Now, when we are fighting a complex disease like cancer, so recitation is not enough. Therefore, we have to make it activate the physical part, which is essential in this case. In this case, it is medicine, and therefore it has to be taken the recommendation of doctors. But combining medicine with information is a good driving force to reach toward complete recovery. Now, how to connect those concepts with, or in the context of personalized medicine? We all know that when Quran talk about what to eat and what to drink, the concept halal-tayyib is always presented. As we all know that the halal-tayyib concept is derived from the so-called true universal reference, which is Quran, and therefore, if we design our medicine in a way that the therapeutic drug and the ingredients, the formulation, or the formulation, which is part of the ingredients, if both are really compatible with the concept halal-tayyib, then in this case, we are offering patients ingredients which are compatible to our body, because essentially they are compatible with the so-called universal reference, which is part of natural order. And therefore, making sure that the medicine is really compatible with halal concept tayyib, and then labeling this medicine with halal tayyib, this will have a multi-factor. First, we will improve the trust between the patient and the medicine. And this is essential because we can gain an additional value and additional effect, which is called placebo effect. Now, the drug by itself has a therapeutic effect. And because we are trying to build a compatible system between the drug and the lifestyle, then we build a compatibility effect. And in biology, usually when we have more than one effect goes in the same. So now we have therapeutic effect, placebo effect, and nuance effect. And we will get usually a bonus effect, which is called synergistic effect. And having this synergistic effect, it means this is probably which will play the most important role in driving our recovery, in driving our treatment toward complete recovery. So in summary, it is important to think how to activate synergy. And synergy comes if we create more than one effect in the same direction. And by personalizing medicine and label it with the concept of halal-tayyib and connecting it with our lifestyle, this is the way how we can build a compatible system and make the existing drug more effective. And this is the final goal, is really how to achieve the so-called miraculous recovery. And miraculous recovery come always under the umbrella of the synergistic approach. Finally, thank you for your attention.